Good morning, Bill Walker, your current Behavioral Health and Recovery Services Director. I want to first start by thanking the Chairman, members of the board. I'd like to also thank the CAO and all public and stakeholders on both sides of this. I think if you said President Trump, gun control, abortion, or any number of issues, you're going to immediately have people on different sides who, no matter, as the Chairman said, no matter what one person says, probably is not going to move their optic very much at that moment. And so I appreciate this opportunity to present to you. I will be presenting primarily on two areas. The first area is impact of cannabis use, especially on youth. The second is recommendations as it relates to prevention and policy related to prevention. Document-wise, I'm really drawing from two different areas. The first area is the excellent documents that the Planning Department included in your packet, the Final Environmental Impact Report, Volume 4, Chapter 7. I want to highlight especially two documents that were in the appendices. The first is the cannabinoids for medical use, a systematic review and meta-analysis, and the second is the health effects of cannabis and cannabinoids, the current state of evidence and recommendations for research. In a nutshell, those two actually concur with virtually everything that public health just presented to you in terms of the risks and the level of risks and the potential positive use in some medicinal areas. I also provided you packets that included several documents from Ventura County, since Ventura is a sister county that is a bit ahead of us on the prevention curve, so that you can see analysis that has already been put together by another county that is facing the same things that we are facing. I also included some documentation from my state organization, CBHDA, which is the California Behavioral Health Directors Association, as well as our consulting firm, Harbidge, as well as the Rocky Mountain and Northwest high-intensity drug trafficking areas. So it's important to kind of know where items are coming from, because the documents that the Planning Department included two very robust studies that are actually meta-analysis. So what they do is they take multiple studies and they put them together. They hold rigorous methodology standards, and then they come and draw conclusions from them. I'm not going to go over the conclusions as the Health Department presented to you, but I am going to now focus the optic more on the effect on adolescents and the developing brain and the developing youth. Obviously, the goal of regulation or ban is that youth wouldn't be using the marijuana and the cannabinoids. That being said, we all know that how that's worked with tobacco and alcohol, and so the importance of how we actually focus on our youth and prevention is vitally important. First up, the perception of risk is diminishing. That probably doesn't surprise anyone that in 1991, studies showed that approximately 79% of 12th graders thought that using marijuana would be bad for them, that it would be substantially bad for them. That has dropped in 2015 to 32%. And so what you see is now less than a third of our high school students think that smoking marijuana or taking other forms of cannabis would be detrimental to them. So there's an inverse relationship between perceived risk and teen cannabis use. And early onset of youth use equals greater risk for developing of a substance use disorder. There are 2 to 4 times more likely to develop an addiction to cannabis if you start smoking as a youth than as an adult. An adult who chooses to smoke marijuana or other forms of cannabis has about a 4% likelihood of developing an addiction. For an adolescent, it's 17%. So clearly, addressing prevention at the adolescent level is imperative, no matter which direction we vote on this measure. I'm going to cite just a little bit of information from studies that were performed in Ventura. They looked at 132 samples of their youth that were brought in for treatment at an acute level of treatment. And of those 132, 98% of them were smoking marijuana or taking cannabis in some capacity. The average age of onset was 13. Keep in mind, this is before legalization. This is through the current way of getting cannabis. For that sample, 49% cannabis was their first drug of choice. So before alcohol, before tobacco, before anything, they were smoking cannabis, 49%. Only 17% started with alcohol. And of that group, 75% started with cannabis or cannabis and alcohol. And so the argument, and this is where you need to consider your optics of what is a gateway drug and what is the likelihood of there being impairment of our youth is a grave risk with cannabis in our environment. So let's talk for a second about the adolescent brain. The adolescent brain is at risk for long-term heavy cannabis use, showing a decrease in the size of the hippocampus, a brain structure important for learning and memory, by 12%. And so the impact, interestingly enough, during adolescence, the neural systems that control emotion and reward-seeking, the limbic system, is fully developed. So teenagers usually know how to have a good time. However, the area of the brain regions associated with executive functioning, for example, problem-solving, planning, working memory, and emotional regulation, are not. And so heavy cannabis use by youth actually impairs brain development, permanent brain development, which impairs education, high school graduation, going to college, et cetera, et cetera. And so, again, no matter which way we go on this issue, looking at adolescent and prevention of our youth is imperative. I'd like to make a couple of comments just about addiction. People have talked about, is cannabis addictive? And the answer is yes. The research quite clearly indicates that 9 to 11% of those that smoke marijuana overall will become addicted. I mentioned the 4% if you start after the age of 22, and much higher percent, 17%, if you start before the age of 18. And so we know that there's an addiction that we will need to deal with and that our department for your community will need to address. Also, the concentration has gone up. The concentration today is about 300% greater than it was 15, 20 years ago. And that means an increase of 3.7% in 1988 of THC to 12.5% currently. So I already mentioned the impact on psychiatric conditions, and this is very, very important, is that my whole field of study has been working with people with mental health and substance abuse addictions. I spent 25 years teaching at Cal State in the drug and alcohol program, and I ran the programs, the inpatient programs for children's and adults before I became your crisis administrator, before I became your director of this department. So I'm very well versed in the effects on drug and alcohol on minor and minor development of problems. So in the area of psychiatric conditions, especially psychotic conditions, it's already been mentioned by public health that there is a much greater risk of developing these conditions if youth use cannabis products. So there's also, it's already been mentioned, the increase in vehicle motor crashes, accidental ingestion, and other problems. So I want to go now to what's, to me, very, very important, is a discussion briefly on what would be the proper prevention tactics. And interestingly enough, I'm going to read something to you also developed through Ventura, because a lot of times when we think of prevention, we think of, well, we go to the schools, you know, we tell the youth don't use these drugs. We tell the parents to tell the youth don't use these drugs. We work through churches to tell people don't use these drugs. But in fact, the greatest prevention impact isn't through those measures. It's actually through, and I'm very pleased as I read through the stuff that the planning department has put together for you to consider, and all of the steps of protection that they're trying to work into that, because, as I read, the prevention field has moved far beyond the confines of education and persuasion and understanding and developing effective youth prevention strategies in the context of drugs that are legally available to adults but illegal for youth, alcohol and tobacco, and now cannabis. The science is well developed and particularly relevant to the implications for youth marijuana use. First and foremost, the science has found that the most effective strategies for reducing and preventing youth problems include raising the price, reducing the availability, and restricting youth exposure to commercial advertising for the drugs involved. the National Academy of Sciences, National Institute on Alcohol Abuse and Alcoholism, U.S. Centers for Disease Control and Prevention, the World Health Organization, and Surgeons General of the United States have documented the scientific evidence regarding these specific prevention strategies as they apply to alcoholic beverages and have made specific recommendations for the implementation at federal, state, and local levels. Understanding this new approach to prevention involves a paradigm shift from a focus on individual youth, seeking to educate and persuade them to be abstinent and to intervene if they ignore the abstinence message, to a focus on the social, cultural, political, and economic environment that youth encounter in their daily lives. The messages youth receive in their everyday community in terms of how a legal drug is made available and marketed are far more powerful than any countervailing messages they hear from parents, teachers, and health officials. Environments are shaped by policy, which can be legislative, laws, regulations, institutional, company and school, and informal neighborhood and watch programs. Policies are therefore an integral part of any comprehensive drug prevention strategies. One of the documents I provided to you is also a document that gives the evidence-based programs for let me quote it correctly, for safeguarding and protecting our young people through the best practice recommendations. And it also provides ways of assuring that you don't develop monopolies that just build and continue to want to grow the sales versus actually meet the market needs. So what I would make as a recommendation is that regardless of a vote of A, B, or the subsets therein, is that you also consider that we continue to focus on prevention and prevention at a policy level, which I want to say first and foremost, I do believe the planning department has tried to include as much of that as they can in what they have put together. Again, I realize that no matter what I say, there will be some people on each side of the fence, some saying, yes, that's the best thing I've ever heard, and others thinking, the guy's an idiot. But I am your Director of Behavioral Health and Recovery Services, and I appreciate the time and am available for any questions.
Supervisor Perez, did you have a question for Mr. Walker?
I do, thank you. Good morning, Bill.
Good morning.
Excuse me, I'm a little bit under the weather. Excuse me. Can you restate your statistics on youth exposure for marijuana use? You said it earlier, and I caught most of it.
Thank you, Supervisor Perez, through the chair. I had stated that in 1991, 79% of 12th graders felt that.
No, I don't mean perception, I mean
Okay.
use, exposure and use. It was earlier, it was before that comment.
So I made the comment that 4% of adults who start smoking after the age of 21 would become addicted, and that 17% before the age of 21 would become addicted. That was one of the statistics I mentioned. And I apologize if I'm not citing the statistic you're looking for.
Did I hear you right, Bill, that the exposure to alcohol use for teenagers, I thought I heard from you, has been reduced over time? Did you say that, Bill?
I don't think I said that the exposure has been reduced over time.
Or the incidence of teenage alcohol use exclusively. Do you remember the statistic you cited?
No, I don't actually. I would have to go back through my notes, but I was not speaking to alcohol use specifically. In alcohol, I was speaking to the relevance of the way what we've learned about alcohol use and how to prevent through policy versus just prevention like at the schools. But I don't think I made a comment that alcohol use has reduced through the years.
Okay. I must have misunderstood you. Thank you, Bill.
Certainly.
Thank you, Mr. Walker. Who'll be next, please?